You are listening to Pulse, the Heart of Nursing, a podcast series on research at the Ellerslie Centre for Nursing Studies at the National University of Singapore. As nurses in acute care settings frequently encounter high acuity events that might trigger stress, the anxiety generated from these stressful clinical experiences inevitably affect learning and clinical performance. But can we train our nurses to better manage stress? In nursing education, simulation has been effectively used for skills training while eliciting the same emotional responses, such as anxiety or stress, in the learner. The physical and psychological fidelity of these situations could train learners to manage their emotions and cope with stress when they encounter similar situations in actual practice. Here with us today is Associate Professor Jeanette Ignacio from the Ellerslie Centre for Nursing Studies at the National University of Singapore. Jeanette is a medical doctor by training who practiced anaesthesia with a PhD in health professions education. She is an experienced academic who has taught undergraduate nursing and medical students and postgraduate advanced practice nursing students. Jeanette has mostly utilised simulation and other innovative pedagogies in her teaching and has published several research papers related to educational strategies to enhance learning. Today, Jeanette will be sharing more about how we could enhance clinical performance by learning to manage stress in crisis event situations. I am Hadassah Joann Ramachandran, a PhD candidate and your host for this podcast. Hi Jeanette, it's nice to have you in the studio with us today.
Thank you for having me. It's definitely a pleasure to be here.
So Jeanette, today you'll be sharing with us an innovative approach to training by integrating emotional training strategies into simulation. So do tell us more.
Yes, in the fast-paced world of healthcare, where patient management and safety are paramount, simulation training that teaches nurses how to manage stress levels may be the key to success in critical scenarios. By addressing the stress levels of nurses and other healthcare professionals, we basically unlock the potential for holistic training that enhances performance, ultimately ensuring optimal patient care and safety. Hi, my name is Jeanette Ignacio and I am an Associate Professor at the Ellerslie Centre for Nursing Studies, the National University of Singapore. I have a Bachelor of Science degrees in Psychology and Nursing, a postgraduate medical degree, and specialized in anesthesia and a PhD in Medical and Health Professions Education. My background has helped me to consider and approach teaching with different perspectives. As a result, I would like to think that students not only see what the role of nurses are, but also what the roles of other healthcare professionals are and what their expectations from them would be.
So Jeanette, how did you come about with this idea to teach nursing students how to better manage their stress levels in crisis situations?
I have read that the more you're exposed to stressful events, the more you get used to it. It's like you feel less stressed because you're already inoculated to the stressor. I remember as a medical student, I was very anxious when we had practical exams, and my stress did affect my performance. I thought more practice would have helped, but we didn't have simulations back then. Practicing technical skills outside of actual scenarios would have helped me to perfect them, but would not have helped me in managing my stress during an actual practical exam, or importantly, when a real-life clinical emergency took place and I was left to manage the patient. Interestingly, I also observed this stress and anxiety in our students. So today, I'll be talking about how what I experienced and what I observed from students made me realize the need to be as holistic as possible in training. We have been using simulations a lot, more for procedural training to prepare students for clinicals. Psychological factors are not usually focal points in these training sessions. I would like to discuss how the factors I uncovered motivated me to explore how emotional training can be part of simulations, as the psychological aspect definitely affects performance. Don't get me wrong, stress can be good. It can motivate, but if there's too much stress, then it could actually impair performance. The idea is to get past the stress and achieve optimum performance.
I hear what you're saying, Jeanette. Comprehensive training is required to enhance healthcare delivery in real-life clinical settings. So you sort of hit me, on the thinking that what else can be done to ensure that students are fully prepared, for the multifaceted challenges of real-world clinical practice?
Well, most of the procedural training in health professions, such as in nursing, happen in the laboratory. However, in real life, it's not only the clinician skill that's important. Other variables affect the quality of healthcare delivery, stress being one of them. If we could include stress management and training, addressing the emotional or psychological component that is part and parcel of a clinical event, then that would prepare students more for clinical practice. We want to mitigate excessive stress that could eventually have implications to patient care.
Yeah, I definitely hear you. The clinical setting can be very emotionally daunting for new nurses and more so for nursing students. What did you focus on in designing such a training program for nurses?
Well, I wanted to focus on clinical events that cause considerable stress and anxiety, especially for new nurses. With some discussion with colleagues, the decision was made to incorporate an emotional training program in high acuity clinical event simulations. This was to prepare final year students for their transition to practice clinical posting.
Yes, I completely agree, Jeanette. Nothing really beats clinical learning in actual settings, and it is good to prepare for this so that the transition to actual practice in the general ward is smoother. What are the key elements to consider when designing an emotional training program for simulations in order for them to effectively prepare nursing students for high acuity or critical events?
The beauty of integrating this emotional training component in high acuity event simulations is that you can select actual clinical event examples, for instance, in a case where a patient deteriorates. The challenge, however, is that you really need to identify what emotional training consists of. There are many potential elements to it. But what elements suit our purpose, that is, to conceptualize an emotional training program and integrate it into simulations for high acuity events? So the study had different phases. First was to find out what interventions have already been utilized to address stress and anxiety in simulations. Second, we tried to determine how to increase the psychological fidelity of simulations so that emotional responses that approximate the responses in the real setting can be elicited. We did this by comparing students' stress levels when using standardized patients or SPs versus 3G mannequins in high-fidelity simulations. Physiological measures such as salivary amylase, heart rate, and blood pressure were used, as well as an anxiety inventory. Third, as mental preparedness was shown to reduce stress, we developed a mental rehearsal strategy as part of simulation training.
I see. So the strategies employed here were the use of standardized patients in simulations and also mental rehearsals. How have these benefited the students?
Well, the findings from the series of studies in this area weren't really surprising. As expected, students found the use of SPs in simulations more stressful than the use of mannequins. However, this wasn't reflected in the stress measures taken from them. Qualitative data highlighted the value of using SPs as this approach really prepares them for clinical interaction with patients. Using the mental rehearsal strategy did help in performance, but stress levels weren't necessarily reduced. Students highlighted that the practice of using imagery helped them when they encountered an actual high acuity event in the ward, such as deterioration. Even though the quantitative results were not generally significant, in-depth qualitative data findings were very promising. Quantitative findings show that there was no significant difference between stress levels of students who used SPs and those who used mannequins during high acuity clinical simulations. These findings were nonetheless explained by the focus group interviews. In essence, the students felt that the stress they got from dealing with SPs is actually the stress they expect to experience when dealing with actual patients. They concluded that using SPs also trained their soft skills. So what we did was to come up with an emotional training program that included mental rehearsal practice and the use of SPs. But more work has to be done as measuring stress is not so easy. Stress fluctuates, and so a real-time monitoring of stress levels may be more useful. And we were not able to do continuous monitoring when we did the project due to some constraints. But just by looking at what the students said when they were interviewed, it is clear that this emotional program of mental rehearsal plus the use of SPs and simulations is the way to go if we really want to train students to be competent, not just in their skills and knowledge, but also competent in their stress management and coping styles.
Wow, thanks Jeanette, that was really insightful. So what sort of obstacles or challenges did you encounter while designing this sort of teaching program?
Yes, creating any new educational strategy or approach can be challenging and would obviously incur costs. The challenge I see is that enhancing this emotional training program and building it into simulations requires resources. SPs need to be trained and paid, simulation venues should be available for all students, and so on. In addition, for the mental rehearsal strategy to have an effect, students should proactively practice using it. All these need to be considered and all these need to be addressed to ensure that this program really helps students manage stress and, of course, improve their performance.
What sort of results and learning points have you observed so far in students who have undergone and completed this program?
Although the program wasn't rolled out in a grand scale, we noted that those who went through it were more prepared. Prepared in the sense that they knew what to expect and they were aware that high acuity events in the hospital are inevitably paired with some form of patient interaction that adds stress to the nurse. These insights help them to be less stressed and, as a result, manage patients better. The training did somehow facilitate stress inoculation. In fact, one student did comment that the program is a stress practice. It's practicing them to be stressed so they cannot be so stressed in the hospital. That was pretty amusing. It's wonderful to be able to share with everyone what we as educators perceive as challenges that limit the optimization of learning, specifically the need for emotional training for stress management. I'm happy that we developed and implemented some strategies that can constitute an emotional training program to help in stress management. As I've mentioned earlier on, more work has to be done. I hope the audience will become interested in this area of education. By addressing the emotional component of training, learning could be made more holistic and beneficial to students.
Thanks for that, Jeanette. You know, this really resonates with me. Having been a nursing student and then a full-time registered nurse myself, I can attest to the importance of being emotionally resilient in healthcare. You know, acknowledging the value of emotional training in stress management within the realm of nursing education is, I would say, definitely a positive step in fortifying the nursing practice and sort of cultivating empathetic yet resilient nurses, you know, well-rounded nurses that are ready for the workforce. And, you know, in that light, would there be plans to do more of this sort of program?
There is definitely value in further developing an emotional training program that could reduce stress and that could be integrated in simulations. And this is to achieve holistic training of nurses and eventually other healthcare professionals. This would definitely have an impact on patient management and safety, as stress at excessive amounts could impair performance.
Yes, you know, I totally agree. And you know, this has really been an enlightening session today. Thank you so much, Jeanette, for the insights and for joining us today.
Thank you for having me as well.
You're most welcome, Jeanette. You've been listening to the podcast Emotional Training, Managing Stress with Crisis Simulations with Pulse, the Heart of Nursing, a podcast series on research at the Anaesthesia Centre for Nursing Studies at the National University of Singapore. With us in the studio today was Associate Professor Jeanette Ignacio, speaking with us on education innovation. I am Hadassah Joann Ramachandran. Thank you. Until the next podcast.